Hello, everyone. Today we are going to talk about all the pregnancy and some pelvic issues. We have Mr. Sujeewa Fernando, MBBS, DFFP, FRCOG, Consultant Urogynecologist, Clinical Director, Obstetrics and Gynecology Department, Wrexham Mailer Hospital, Welsh Fellows representative for the RCOG, and he's a RCOG council member, British Society of Urogynecologists. With a strong passion for education, he was awarded the National Trainer of the Year Award, UK in 2022. Like Mr. Fernando consistently receives excellent patient feedback, highlighting his expertise and compassionate care. So we welcome you, Mr. Sujeewa, to our
Thank you so
program.
much for having me today. Thank you.
Yeah. Could you please give us a little bit of your background?
Yes, I'm delighted to be here today. And as you quite rightly given a very good introduction, thank you for that. Actually, I was born in Sri Lanka and studied in Sri Lanka. I completed my primary medical qualifications from Sri Lanka. I did my internship from Colombo South Teaching Hospital. Following that, I came to UK to do further studies, where I did my postgraduate training in obstetrics and gynecology, and subsequently I developed a special interest in urogynecology, where I do practice as a consultant urogynecologist, where I tend to see women who are having pregnancy-related problems as well as pelvic floor dysfunction. So I do medical as well as surgical interventions to make their quality of life better. Thank you.
Yeah, thank you. So could you please describe a little bit of like importance of healthy pregnancy?
So every pregnancy, whatever pregnancy it is, it's a pregnancy number 1, 2, or 5. It's a very precious thing for all the women across the globe. They want to have a healthy child. They want to have uncomplicated birth. Unfortunately, it's not always possible. But what we could do is to make it more healthier, to optimize and to minimize complications. We have to plan. One, before they become pregnant, they need to do certain things to optimize their health. For an example, if they have conditions like diabetes, high blood pressure, obesity, they should optimize the treatment and lose some weight, optimize the body mass index. They should start eating healthily. If they are smoking, cut down or stop smoking, minimize or stop alcohol intake, regular exercise, and also they should start taking folic acid at least 3 months before they conceive. That will minimize neural tube defects, in the sense brain development and the spinal cord development get better. It minimizes the complications associated with that. And then once they become pregnant, it is important they seek help from healthcare professionals. If it's an uncomplicated pregnancy in countries like UK, the midwives look after women. However, in Southeast Asia, it is a medical as well as midwifery input. And then they should visit their doctors, midwives regularly during the pregnancy to have a better outcome.
Right. Thank you. And what are the things women should do prior to plan a C-section surgery?
Okay, so now when you look into the mode of delivery, there are two modes babies could come, either vaginally or abdominally. Vaginal birth is called normal vaginal birth, which is the most common method where a baby is born. But however, due to certain situations, circumstances, diseases, or due to maternal choice, they can have a cesarean birth. So usually, if the pregnancy is uncomplicated, they have their birth about 1 week before their due date. So it is called an elective or planned cesarean birth. Sometimes they have cesarean birth due to an emergency. It's a condition where the mom is facing, or if you have concerns related to the baby, they perform an emergency cesarean birth. So, when they have a cesarean birth, the mom should know the risks associated with the procedure. So, it is important that you obtain their informed consent. To obtain informed consent, wherever in the world, you should tell the woman what are the risks and benefits of the surgery. The risks are it's a major operation, they could have bleeding, infection, accidental damage to bladder, ureter, bowel, blood vessels. They could develop blood clots. They could even die in unfortunate situations. So they should be given the gravity of the surgery. People think it's a small cut, go in, come out, but it could be that way or the other way. So it's very important to have a planned procedure whenever possible, have a good anesthetist, have the bloods ready in case if they bleed. So this is how it is, this is what they should know, and they should have a shared decision making tool. So the clinician as well as the woman and the family should have a good discussion before they have the cesarean section.
Okay, thank you. And what should women do to minimize complication of childbirth?
So now, as we discussed, there are two ways the babies can be born to this world. One through the vagina, which is the normal vaginal birth. So to minimize the risks associated with normal birth, they should do regular exercise, eat healthily, attend all the clinic appointments. So they will monitor the baby's growth if needs to be. So if the baby's size is bigger, so certain sizes, especially if they are diabetic, if the baby's weight is above 4.5 kilograms, they are better off having a cesarean birth rather than having a vaginal birth. Also, if they are doing regular pelvic floor muscle exercises, it can be minimized the tears and complications happen at the time of cesarean, at the time of vaginal birth. Also, they should deliver the baby in a safe place, either midwifery-led unit if appropriate, or in a hospital where medical attention is available, where blood banks are available, have the access to theaters, so that the women can have a safe delivery when planned. However, even with all that plans, still they could have massive bleeds and other complications. Similarly, in the cesarean sections also, if they optimize their weight, body mass index, the surgery related complications can be minimized.
Okay, thank you. What can women do if they develop like pelvic floor dysfunction?
So this is unfortunately unavoidable. Lot of women develop because the pregnancy itself can damage the pelvic floor, but it is worse in some women compared to the other. For an example, if the woman is smoking, obese, if they have a poor collagen in the body, their pelvic floor is already weak. So pregnancies make it even worse. So the pelvic floor dysfunction has got two components. One, urinary incontinence. Two, pelvic organ prolapse. So what they should do is, they think it's a big stigma. They are a bit shy to talk about it. So what we see today is a tip of iceberg. There are so many across the globe. They don't come forward. They are reluctant to talk. So that's why it is important having this sort of programs to educate women across the world to come forward, because the help is out. So they should come forward and get it sorted.
Right. And how do we minimize complications in that area?
So again, what they do is they should start doing pelvic floor muscle exercises that can be guided through a physiotherapist or a continence advisor. They should cut down fizzy drinks, caffeine. If they drink tea, coffee, they have to minimize the number of cups of teas, coffees they consume, or they have to replace normal tea, coffee with a decaffeinated tea, coffee. And if it is not helping, we have medical treatments. If medical treatments are not helping, we have further interventions we can do. For an example, if they have overactive bladder, we can inject botulinum toxin A, so-called Botox, into their bladders. If they have stress urinary incontinence, if they are leaking when they cough and sneeze, we can do certain operations to correct that weakness. In relation to pelvic floor prolapses, again, we can offer pelvic floor exercises if they are very small, early degree prolapses, or they could have a pessary, which is a foreign object, goes into the vagina, but these pessaries needs changing every 6 months or so. If that doesn't work or if that is not suitable, they can have surgeries to get that corrected with very good results.
Okay, thank you. And do you have any like experience that you went through, like, that you can give us a little bit of ideas?
Of course. So I have treated thousands of women. They are from different ethnic backgrounds because the UK is a multinational country. As
Yeah.
well as when I was a junior doctor in Colombo, I have seen women with similar problems. So, with my expertise, with my subspec knowledge, I have treated women who lose their quality of life because they could not pray, because they felt they were not clean. They broke down their marriages because they lost the confidence to have the intimacy with their husbands, partners. Finally, they managed to come to see me, us in the hospital, where with simple interventions, we made their quality of life better. They started their life again, which they were quite thankful. This is one of the examples of thousands and thousands of women which I have seen, but there are millions in this world who has not come forward yet. So it is very important we educate, spread the message across the globe for them to come forward so we can help.
Yeah. Yeah. Thank you, Sujeewa. And thank you so much for your time. Brinda, do you have any questions?
Tanuja, thank you so much. And it's really interesting. I'm listening to it.
Yeah. So thank you so much for your hard work, and we appreciate you, and also we are proud of you. So thank you, Sujeewa, for joining with us. Yeah.
Thank you so much for having me today. Thank you. All the best.
Thank you.